the importance of vaccination is actually to protect the child from getting that particular disease. And protecting the child from getting that disease is much more important because prevention is better than cure, as you can see. Simply because when a child is afflicted by that disease, it means long hospital admissions, disease mortality, disease morbidity. It also is an economic loss for the parents because they have to take time off work and they have to take leave, and this all causes a lot of inconvenience. Now, the other importance of vaccination is, of course, not only are you vaccinating that individual from that particular disease, you're also protecting the community as a whole. Because there are some individuals that cannot come up with any immune response, especially with the very young infants, or if the child has been suffering from some kind of disease and is undergoing chemotherapy and therefore vaccination is contraindicated, or if the child has got some disease where they cannot produce any antibodies at all. So by vaccinating the children around them, they are actually being protected by that particular disease. So these are the few reasons why we actually emphasize a lot on vaccination. The vaccinations which are compulsory, there are a few of them, okay, beginning with the BCG, which is a vaccine against tuberculosis. Then we have the hepatitis B vaccine, which is given at birth and 1 month and subsequently at 5 months. There are 3 doses. The other compulsory vaccines are against diphtheria, tetanus, pertussis, polio and Haemophilus influenza. Now these vaccines come in a combination form, so all 6 vaccines in one shot of vaccination, which is given again for 3 times. Subsequently, at 1 year old, the child receives the MMR vaccine, which is measles, mumps and rubella. And then subsequently, they will be receiving their booster doses of the triple vaccine plus polio and HIV, as well as another shot of measles, mumps and rubella. These basically constitute the compulsory vaccines. But in private practice, we have additional vaccines, which are what we call optional vaccines, like the pneumococcal vaccine, rotavirus vaccine, hepatitis A, as well as chickenpox vaccine. Yeah. Now, the reason why these vaccines are given is basically to prevent the diseases that they represent. As you know, there are a lot of complications if a child would be suffering from these diseases, and these diseases can cause both mortality and morbidity. Okay, if I were to compare 20 years ago, I think if I remember correctly, I probably was a young medical officer at that time, and I used to work in Sarawak, and I think during that time there was no hepatitis B vaccine, neither was there Haemophilus influenza B vaccines, as well as the pneumococcal vaccines. So when I compare those times with current times, I actually don't see those diseases very much now. So in actual fact, the vaccination program have actually prevented children from getting these diseases. And comparatively, I've seen a lot of complications from these diseases. You get children who are afflicted with Haemophilus influenza, for instance, and getting meningitis, and if they do not die from that disease, they actually end up being children with cerebral palsy or with fits or epilepsy or being mentally retarded. So there's a lot of morbidity associated with these diseases. I think the concern is whether the child will be allergic to the vaccine. Now, if you have not been exposed to that particular vaccine, there's no way of knowing whether you're going to react adversely to that vaccination. But for those children who have an egg allergy, for instance, then things like the MMR vaccine, which is actually a vaccine which is produced with the egg embryo, or using egg proteins, then you have to be very, very cautious to use these vaccines in these children. If these children have very severe allergic reactions towards egg or any egg components, then it is mandatory that we actually admit these children and make sure the vaccines are given under very controlled situations, and should they react to these vaccines in an adverse manner, then we will have the resuscitation to back up. So it cannot be given as an outpatient. The child just can't come to you, get the vaccination and go home in case there's adverse reaction. When a child is born, basically they are protected by the what we call maternal antibodies, which is transferred through the placenta, and these antibodies probably will be in the baby's body system for about 6 to 12 months. However, not all diseases are protected by maternal antibodies. So therefore, after 6 months, the antibodies start weaning off, and therefore the child has to start building up their own immune system. And during this time, when the immune system is being is maturing, sometimes the immune system is not strong enough or mature enough to handle when the child faces an infection. So that's where things like nutrition kick in, and sometimes we need to supplement these children with vitamins, therefore to protect the child from getting these infections. So it boils down to basic things such as good nutrition, good hygiene, good hand washing, and how we handle the child as a whole. So it is there's no added like medications that we could give to prevent children from getting any diseases. Basically, it's the immune system. But for the first 2 years, I think it's important they get vaccinated, because with vaccination it ensures that antibodies can be produced by the body. Whereas if we rely on the natural immune system, it may not be mature enough or strong enough to handle the onslaught of the disease.